Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 110. A 32-year-old woman complains of tumor-like formation on the anterior surface of her neck that appeared 2 years ago. Within the last 3 months the tumor has been rapidly growing. It hinders swallowing and impairs speech. The tumor causes a sensation of pressure. Objectively, the skin moisture is normal, pulse is 80 per minute. Rhythmic, blood pressure is 130/80ths of a millimeter Hg. In the right lobe of the thyroid gland there is a dense lumpy node 3.0 times 3.5 centimeters that moves during swallowing. Scanning image shows a cold nodule in the thyroid gland. Make the provisional diagnosis. A. Thyroid adenoma. B. Thyroid cancer. C. Nodular goiter. D. Thyroid cyst. E. Autoimmune thyroiditis. Thyroid nodules are classified as cold, warm, or hot, depending on whether they produce thyroid hormones or not. Cold nodule does not produce thyroid hormones. Warm nodule acts as normal thyroid cells. Hot nodule overproduces thyroid hormones. On a radioactive iodine uptake test, a cold nodule takes up less radioactive material than the surrounding thyroid tissue. A cold nodule may be malignant or benign. On scintigraphy, cold nodules do not show but are easily shown on ultrasound. A thyroid scan is a picture of the thyroid gland taken after a small dose of a radioactive isotope, normally concentrated by thyroid cells, has been injected or swallowed. The scan tells whether the nodule is hyperfunctioning, a hot nodule. Because cancer is rarely found in hot nodules, a scan showing a hot nodule eliminates the need for fine needle biopsy. If a hot nodule causes hyperthyroidism, it can be treated with radioiodine or surgery. Thyroid ultrasonography can visualize nodules as small as 2 to 3 millimeters, that distinguishes thyroid cysts, fluid-filled nodules, from solid nodules. Solid nodules have little fluid or colloid and are more likely to be cancerous. Still, most solid nodules are not cancer. Some types of solid nodules, such as hyperplastic nodules and adenoma, have too many cells, but the cells are not cancer cells. The main symptom of thyroid cancer is a lump or swelling at the front of the neck just below the Adam's apple, which is usually painless early in the disease. However, as it grows, it may become symptomatic. Women also have Adam's apples, but they are much smaller and less prominent than a man's. The lymph nodes in the neck can also be affected and become swollen. Symptoms of thyroid cancer: a lump, nodule, that can be felt through the skin on the neck. A. Tight or full feeling in the neck. Swollen lymph nodes in the neck. Difficulty swallowing. Pain in the neck and throat. Changes to the voice, including increasing hoarseness. The answer is B. Thyroid cancer.